Hello, healthy people. Your favorite online physiotherapist is here again. My name is Elizabeth. I'm here to talk about meningitis. What is meningitis? Meningitis is an inflammation of the covering of the spinal cord and the brain. Meningitis is usually caused by bacterial or viral infection. Other causes are brain injuries, cancer, certain drugs, or other types of brain infection. So if you have meningitis, you may start having some kind of fever, some kind of symptoms, which are fever, headache, stiff neck, drowsiness, seizures, sensitivity to bright light, fatigue, and tiredness. When you start seeing all this, you need to know that probably you may be having meningitis. And also, it is important for you to know that meningitis is very contagious and can be transmitted via respiratory droplets. So when you are with someone that has meningitis, you need to be very, very careful because it is very highly contagious. And when you experience these symptoms, it is important for you to seek immediate medical attention because meningitis can be very deadly. Meningitis can be very, very deadly and can be diagnosed as chronic. Meningitis can be diagnosed as chronic when your symptoms last longer than 4 weeks. And when this is noticed, it is advisable for you to report to the hospital. Please note, vaccine is available for meningitis because it is very, very deadly. So when you are taking your children for vaccination, ensure that vaccination for meningitis was given. And how can meningitis be diagnosed? You need to take the history. When did it happen? How did it happen? What are the symptoms that the patient started feeling? You need to do physical examination. Check for fever, check for neck stiffness, check for skin discoloration, pale. Also, you need to do lumbar puncture. The doctor will do lumbar puncture to check for CSF, that's cerebrospinal fluid. They also do blood cultures, full blood count, chest x-ray, CT scan, and so on to be able to determine whether you actually have meningitis. Now, what are the medical treatments of meningitis? Treatment of meningitis is based on the cause. For instance, if it's a bacterial meningitis, it requires hospitalization and can be treated with IV antibiotics and steroids. If it is fungal meningitis, it can be treated with antifungal agents. It can be treated with antifungal agent. Parasitic meningitis can be treated based on symptoms. If patient is having fever or other symptoms, it will be treated based on that. Then viral meningitis may resolve on its own, but antiviral medication can also be used. So treatment is based on the symptoms and the presentation. Now, how can you prevent meningitis? Prevention of meningitis is first of all through vaccination. You need to get vaccinated so as to prevent meningitis. Then you get adequate rest. So how do we prevent meningitis? One important way to prevent meningitis, it is through vaccination. We need to get vaccinated. Children need to get vaccinated against meningitis. Also, adults need vaccination. We need to get adequate rest. Avoid contact with sick people. Protect yourself from those that have meningitis. Also, wash your hands often. Now, let's talk about physiotherapy. How does physiotherapy come in when it comes to the treatment of meningitis? Physiotherapy plays an important role when it comes to meningitis. We are often needed for secondary complications of meningitis. What are the secondary complications of meningitis? By the time meningitis gets to a stage that has not been treated, a patient starts to have muscle weakness and poor balance. Now, how does physiotherapy come in? Physiotherapy helps with the strengthening exercise to these weak muscles through sit to stand exercises, training, walking, and balance. These are the things that physiotherapists will do to be able to help an individual patient to get back to their former position or former situation. And also, stretching exercise is also very, very important. We mentioned about neck stiffness the other time. Due to neck stiffness, physiotherapy will help to stretch the neck. Also, balance exercise, because such a patient will also lose balance. Physiotherapy will help with balance exercises during walking, running, and cycling. Then coordination exercise will also help. Physiotherapy will also help during coordination with coordination exercises, helping the patient to be able to catch ball while throwing a ball to the patient, juggling balls, kicking football. Physiotherapy play an important role when managing meningitis. Now, this is all I've brought to you in this session of our health information. Please do not forget, get vaccinated against meningitis because meningitis can be very deadly. Till I bring another important health topic for you. See you next time. Please share, follow, like, and also subscribe to our YouTube channel so that we can bring more information for you as we always do. Thank you. See you next time. Bye.